Kidney cancer occurs when cells in the kidneys alter and grow out of control. People who have kidney cancer may experience flank pain, high blood pressure, blood in their urine, and other symptoms. Treatments for kidney cancer include surgery, chemotherapy, and radiation therapy. As with other malignancies, early identification is critical to successful treatment. What is kidney cancer? Kidney cancer is the abnormal proliferation of cells in the kidney tissue. These cells eventually form a tumor. Cancer occurs when something changes in the cells, causing them to divide uncontrollably. A cancerous or malignant tumor may spread to other tissues and essential organs. Metastasis is the term used to describe this process. Who does kidney cancer affect? Kidney cancer is most common in people aged 65 to 74. Men are twice as likely as women to get the condition. It's also more prevalent in Native American and Black communities. Kidney cancer is far less common in children. However, in the United States, 500 to 600 children are diagnosed with Wilms tumors, a kind of kidney cancer, each year. What are the types of kidney cancer? There are different types of kidney cancer, that includes renal cell carcinoma, RCC. Renal cell carcinoma, RCC, is the most frequent type of kidney cancer in adults, accounting for approximately 85% of all kidney malignancies. Renal cell carcinoma often begins as a solitary tumor in one kidney, although it can affect both. Cancer begins in the cells that line your kidney tubules. Transitional cell cancer, transitional cell carcinoma, occurs for 6 to 7% of all kidney cancers. This cancer typically originates where your ureter attaches to the major section of your kidney. This area is known as your renal pelvis. Transitional cell carcinoma can also occur in the ureters and bladder. Renal sarcoma. Renal sarcoma is the least frequent type of kidney cancer, accounting for approximately 1% of occurrences. It begins in your kidney's connective tissues and, if left untreated, can spread to neighboring organs and bones. Wilms tumor. This is the most frequent kind of kidney cancer in youngsters. It accounts for around 5% of kidney malignancies. Kidney cancer symptoms may include blood in pee, a lump or mass in your kidney area, flank pain, tiredness, a general sense of not feeling well, loss of appetite, weight loss, low-grade fever, bone pain, high blood pressure, anemia, high calcium. What is the primary cause of kidney cancer? The specific cause of kidney cancer is unknown, however there are some risk factors that can raise your chances of developing the disease. They include smoking. People who smoke are more likely to develop kidney cancer. In addition, the longer a person smokes, the greater the danger. Obesity. Being overweight increases your risk of developing kidney cancer. In general, the higher a person's weight, the greater the danger. High blood pressure. High blood pressure, also known as hypertension, is associated with an increased risk of kidney cancer. Family history. People who have a family history of kidney cancer may be more likely to acquire it themselves. Radiation therapy. Women who have received radiation therapy for cancer of the reproductive organs may be at a slightly higher risk of acquiring kidney cancer. Long-term dialysis treatment. Dialysis is the process of cleansing your blood by passing it through a specialized machine. Dialysis is utilized when a person's kidneys do not function correctly. How is kidney cancer diagnosed? If you have kidney cancer symptoms, your doctor will conduct a thorough medical history and physical examination. They may also prescribe tests to aid in cancer diagnosis and evaluation. These tests can include blood tests. Blood tests count the number of each type of blood cell and examine different electrolytes in your body. A blood test can reveal whether you have too few red blood cells, anemia, or whether your kidney function is impaired, by measuring creatinine. Ultrasound. Ultrasound is a test that uses high-frequency sound waves sent through bodily tissues to produce images on a monitor. This test can detect malignancies, which have a different density than healthy tissues. CT scan. A CT scan is a type of X-ray in which a computer generates a series of images, or slices, of the inside of your body. This test is commonly performed using intravenous contrast, dye. Individuals with compromised kidney function may be unable to receive the dye. Magnetic resonance imaging, MRI. Magnetic resonance imaging, MRI, is a test that uses a powerful magnet, radio waves, and a computer to create images of the inside of your body. Renal mass biopsy. This procedure involves inserting a tiny needle into the tumor and removing a small sample of tissue, biopsy. A pathologist will examine the tissue under a microscope to determine whether there are any cancer cells. Because biopsies for kidney cancer are not always 100% trustworthy, your doctor may or may not recommend this test. When to visit a doctor. Getting an early diagnosis typically improves a person's attitude. Medical professionals analyze historical data to estimate how likely persons with cancer are to live at least 5 years following diagnosis compared to the general population.